Hello everyone, welcome back to FACT Facial Assessment with Clarius Technology. I am Dr. Roya Zarmezamin and today's episode is about an interesting topic. Is the beneficial use of ultrasound assessment before HIFU treatment, high intensity focused ultrasound? It's very important to know that if you need to get a predictable, natural, good results with HIFU treatment, you need to know where is the target. The target for this treatment is SMAS, superficial musculo-aponeurotic system. We all know that HIFU is good for lifting the sagging area. It's good for repositioning the structure and also for defining the jawline. But if you don't target the main area, which is the SMAS, precisely, you don't get the result or you get complications. It's important to know in every single area where is the depth of the SMAS is, and even from patient to patient is different. That's why we are going to assess pre-treatment and check everything and choose the right and proper cartridge for the specific area. I'm start scanning, but as you see for the patient, I just part the area that I'm going to do a HIFU treatment. I'm using Clarius L20, a linear probe, and choose the jawline preset. Now I'm going to start the scan for this area, but make sure that all the scanning, it should be with zero pressure. And zero pressure, as you see, I can measure easily the depth of this mass, which is here. From the epidermis to just the hyperechoic line below the subcutaneous fat pad. This is 8.3. And I can document this area. With the usual cartridge for the face, we cannot target SMAS in this area. Let's go to another part, another area that I'm going to treat. Zero pressure. As you see, the white epidermis is completely visible, and on top of the epidermis, you see the hypoechoic ultrasound gel. Again, the measurement from here to here is 7.5, and I can document and or mark on the surface. Next area, which is the most anterior area, as you see here. Let's just here the scan, and again zero pressure, because if you're not scanning with zero pressure and press too much, you can compress the tissue and the measurement is not correct. Here and here. 9.6, not a good candidate with the regular standard cartridge for the face. And as we all know that the standard cartridge for the face starts from 4.5 millimeter, 3.0, and the most superficial one is 1.5 millimeter. It shows that this patient is not a good candidate with a standard cartridge. You may need to do something for subcutaneous fat pad first, or you can even use some standard cartridge but to make the slimmer face. You can easily customize the treatment for specific patients and give the patient a predictable outcome. That's the best outcome you can do with a specific treatment device. In conclusion, every single treatment that going beneath the skin, you need to visualize real-time image and see everything beneath the skin to customize your treatment. Thank you for joining us for this fact episode, and stay tuned for the next one.